in a military unit and a PhD candidate at West University, Timisoara, specializing in philosophical counseling and applied philosophy. Her research explores philosophical practice in relation to gender equality, proposing a feminist model of philosophical counseling. She takes an interdisciplinary approach at the intersection of philosophy and psychotherapy with a strong focus on philosophical counseling. She is developing the integrative, rational compassion method inspired by compassion-focused therapy and logic-based therapy. And today she is speaking on her work, Empowering Through Care, Integrating Logic-Based Therapy and Compassion-Focused Therapy to Combat Oppression.
Hi, everyone. Can you hear me? Yes. Let me share my screen. I don't know how to do that, but I really don't know how to do that.
At the bottom, there's this, on my screen.
Yes, I did push that button, but share? I don't know.
And then you have to have something up already, and then it'll allow you the option.
I have my presentation, but you can't see it,
the
right?
share button. This is the green share button. If you have
Yes,
it.
I did that. Keynote, but I might have an older system, and maybe I can send it and you open it. I don't know, or speak without it. I don't know. I'm sorry.
If it's necessary, either way, you could try to email it to me, and then I could try to share it.
Okay. Just a second. I'm sorry for this delay.
But if you could maybe start your presentation while I'm getting things done on my end, that would be great. But you might want to write this down. I don't know. My email is Kliver, KLIVER at pnw.edu.
Oh, you lost me. Cliver.
Yeah, she's right there, right on the screen. So so it's pretty simple. Kliver at pnw.edu.
Maybe Clive, if you write it in the chat, your email.
Yes, thank you. Thank you, Anka.
While we're waiting, I just wanted to make a quick correction because I'm in Central Time. So I'm here until 5 Eastern Time. Okay, just a quick correction.
Maybe if it's this difficult, I can speak without the slides. I don't know. Right. So?
I haven't seen anything. If you could start without it, that would be great. And I'll keep checking on my end.
Okay, so today I'm excited to introduce you to a method that my supervisor and I have been developing, Rational Integrative Compassion. CRI is the acronym in Romanian. First of all, I wanted to tell you that I'm a clinical psychologist, and I work in a military unit, but I'm not a military. I just work there. I'm a civilian, and also a PhD candidate, as you've stated. So before you think this is another psychological theory, I promise you this is not just a theory for the sake of theory. CRI is a structured, practical approach designed to help individuals navigate discrimination and self-criticism using two key tools, logic and compassion. So CRI belongs to philosophical counseling, and it is designed specifically for victims of discrimination, and it is deeply rooted in the third wave feminism, meaning it recognizes that emotions are not just personal struggles, but experiences shaped by social structures, systemic oppression, and power dynamics. At its core, CRI is inspired by two brilliant minds, Elliot Cohen's logic-based therapy, because let's face it, our minds love to play tricks on us with irrational thoughts, and Carol Gilligan's compassion-focused therapy, because real growth isn't just about thinking differently, it's about feeling supported in the process. So today in this presentation, we'll explore the theoretical foundation of this approach, the 10-step intervention model CRI, and how it actually works in real life. I've also prepared a case study to present you. Okay, do I have the email or no? Not yet. So I'll continue without the slides. It's okay?
Yeah, I'm sure that's fine by all of us. It is by me. I haven't received anything yet on the chat or on an email.
So I'll talk like that without the keynote presentation. Okay, let's dive in. Theoretical foundation. Before we get into the 10 steps method, let's talk about the brains behind this CRI. And as I've stated before, CRI is mainly built on two key therapeutic approaches, logic-based therapy developed by Elliot Cohen. So if you've ever had a thought so irrational that even your best friend rolled their eyes at you, congrats, you've experienced cognitive distortion. And everybody, you're not alone, everybody experienced that. So our brains are masters at twisting reality in ways that fuel anxiety, self-doubt, and unhelpful behaviors. And LBT helps us spot these self-sabotaging thought patterns and counter them with logic. I didn't know there's gonna be so many psychologists among us, so pretend you don't know what I'm going to tell you next. Most common culprits look like catastrophizing. It's about jumping to the worst possible conclusion. For instance, if I mess up this presentation, my career is over. Reality check. One mistake rarely defines our future. Or black and white thinking, seeing things as all good or all bad with no middle ground. If I don't ace this exam, for instance, I'm a total failure. Reality check, life is full of shades of gray, and one setback doesn't erase your skills or potential. Mind reading, assuming we know what others think, but usually in a negative way. He didn't text me back, he must be mad at me, for instance. And people have busy lives, their silence usually isn't about you. Self-damnation, defining yourself entirely but by your mistakes. I forgot an important deadline, I'm such an idiot. And reality check, everyone makes mistakes, one error doesn't erase your worth. So Cohen's method teaches us to challenge these distortions by applying reasons and evidence instead of letting irrational beliefs control us. And LBT helps us reframe them with more adaptive thoughts. The other therapeutic approach is compassion-focused therapy developed by Carol Gilligan. Logic alone is powerful, but it's not always enough. restructuring irrational thoughts with reason is essential, but without emotional validation, logic can sometimes feel cold or dismissive. This is where Gilligan's ethic of care and compassion-focused therapy come in. She argued that while rational helps us challenge distorted thinking, true healing requires clear reasoning and compassionate understanding. So instead of simply saying that thought is irrational, compassion-focused therapy takes a step further. That thought is irrational, and let's explore why it feels so real to you. So by integrating both logic and compassion, we create a space where cognitive restructuring is not just intellectually effective, but also emotionally transformative. CRI is also built on a strong philosophical and psychological foundation, integrating insights from multiple disciplines. And here I've stated 4 of them. Emotions as moral evaluation, Robert Solomon. Emotions are not just reactions, but active judgments that guide ethical decision-making. Compassion as a moral emotion, Martha Nussbaum. Compassion allows individuals to connect with others, suffering, and act morally. And compassion and social oppression, intersectional feminism. Social injustice shapes emotional experience, and compassion is a tool for resilience. And cognitively based compassion training. Compassion is not just seen as an emotion, but a trainable skill that promotes resilience and well-being. So I'll talk now about the about how this 10 steps CRI intervention actually works. And as I've said, it follows a structured 10-step process, which might sound intense, but I'll break it down, try to explain each step. So first thing first is introducing this concept of compassion. And why is compassion, and what should we care? Many people see it as a weakness, when in reality is one of the strongest tools for emotional resilience. And here at this step, we reframe compassion as an active, rational process. The second step is initial assessment and identifying emotional blocks. We explore why some people actually fear compassion. Yes, that's a thing. Some people fear compassion. And the common blocks are shame, guilt, and or the belief that self-compassion means weakness. The third step is establishing therapeutic goals. Why this is where clients set realistic, achievable goals like reducing self-criticism or improving self-worth, not vague, be happy goal, but concrete steps. Real concrete steps. Creating emotional safety, the fourth step. This is about mindfulness, grounding techniques, and creating a safe space, because no real progress can happen if we are in survival mode. The next step is education on compassion. Here we answer the big question, what's the difference between empathy, sympathy, and compassion? And hint, only one of these actually helps long-term. The sixth step is compassionate mind training. Clients practice self-compassion exercises, because if we have been spent years being self-critical, we need to actively train our minds to start to be kind. The seventh step, integrating mindfulness into daily life. Basically, practical strategies for not spiraling into self-doubt and panic again. The eighth step is exploring and restructuring complex emotions. Emotions like shame and guilt don't just disappear by magic. We don't get rid of them, but we transform them. The ninth step is developing healthy relationships and empathy, because self-compassion and empathy for others are deeply connected. Cultivating emotional awareness and setting healthy boundaries is essential for fostering meaningful and balanced relationships. And the 10th step, the final evaluation and long-term integration. Clients create a long-term plan for maintaining their progress, because the goal isn't just temporary relief, it's lasting emotional resilience. So there you have it, the 10 steps that takes people from self-doubt to self-empowerment. The impact of the application, so, or other way said, why is this relevant? For individuals, for therapists, and for social change. For individuals, CRI helps people challenge toxic beliefs, break free from shame and build confidence. For therapists or philosophical counselors, it's a structured step-by-step method that combines logic and emotional support. And for social change, okay, healing is personal, but it's also political, because CRI bridges the gap between therapy and activism. So in short, this method isn't just about feeling better, it's about reclaiming power. To sum it up, CRI combines logic and compassion to tackle self-criticism and emotional pain. It's a step-by-step process, and it's a tool for both individual healing and social empowerment. Now I can talk about the case study I've prepared, if you like. So I have chosen this case to present you because it illustrates how CRI operates in real life situation. And in this particular case, I like to highlight the complex interplay between gender, ethnicity, and leadership in a male-dominated profession. So my client is a female, 28 years old female, ethnicity Roma. It's a minority in Romania. I don't know if you know. As a profession, currently she's an army officer, but as a background, she was a former military master surgeon promoted to officer via indirect route 2 years ago. As a work environment, she, as I've stated, she is in Romanian army, so a predominantly male environment. And the challenge is facing workplace discrimination, microaggressions, and self-doubt about leadership credibility. So before I begin, let's take a moment to contextualize a little bit the Roma experience in Romania for those who don't know. The Roma community is one of the most marginalized ethnic groups in Europe. In Romania, Roma people have historically faced social exclusion, economic discrimination, and deeply ingrained stereotypes. While legal frameworks prohibit discrimination, implicit bias remain a persistent issue, though. So, women from Roma community face a double burden. First is gender bias in a professional environment where women, particularly in the army, are scrutinized more harshly. And ethnic prejudice, often rooted in stereotypes that depict Roma individuals as less disciplined or less competent or inherently different from the majority of population. I won't go into extensive details about the status of Roma people in Romania, since it's not the purpose of my paper and of this presentation, but I just wanted to give you a sense of the situation. So with this in mind, let's turn to the case, which I particularly find very compelling because it highlights the triple axis of discrimination. First, as a woman in a male-dominated military environment. Second, as a Roma individual facing prejudices. And third, but not less important, as an officer who advanced through the indirect career path, a route often unfairly dismissed by traditional military personnel as undeserved shortcut, or rather than a legitimate achievement. Now I want to walk you through the 10-step method with this client. So first step was introducing compassion as a leadership tool. From the outset, my client believed that compassion and leadership were incompatible concepts. Years of military training had reinforced the idea that authority required detachment, and her experience with persistent microaggressions only deepened this belief. She felt trapped in a double blind. If she showed strength, she was perceived as too aggressive. If she exercised empathy, she was seen as too soft. So either way, she gave the bad answer. She had also become hyper aware of how her male colleagues were treated differently. When they asserted themselves, they were viewed as strong leaders, but when she did the same, she was labeled as emotional. So what I did, I worked with her to reframe compassion as a leadership asset. We explored examples of strong, compassionate leaders, demonstrating that emotional intelligence is not a weakness, but a strategic advantage. This shift in perspective allowed her to see that effective leadership does not require rejecting emotions, but rather understanding the channeling them differently. On the second step, we try to identify emotional barriers and intersectional bias. So through structured assessment and reflective exercises, we identified several core emotional struggles, and I've stated 3 of them. Imposter syndrome, the most important, driven by the feeling that she constantly had to prove her worth, and that feeling was deeply rooted in the way she had advanced through the indirect career path. And I explained you earlier what this means in the hierarchy and tradition of the army. So her promotion was not viewed as a recognition of her skills, but rather as taking the easy way. After that, we have ethnic stereotyping, where her Roma identity led to assumptions that she was less competent, and microaggressions discussed as humor or innocent jokes, reinforcing the idea that she did not fully belong. So she recalled one incident at a training session where a colleague had jokingly told others, "Be careful, she might put a curse on you if you disagree with her," and the room erupted in laughter. Although she forced a smile at the time, the moment lingered with her. And when we revisited this moment in therapy, she initially dismissed it as just a joke, but when asked how it truly made her feel, she admitted that it triggered an old, long-standing fear that no matter what, she'll always be seen as a Roma woman. So what I did, I introduced her the concept of intersectionality in order to help her understand how race, or in her case, ethnicity, and gender bias discrimination intersect. We also discussed how these type of jokes are not harmless, but rather subtle forms of exclusion. On the third step, there was about establishing therapeutical goals, and to help her navigate these challenges, we set clear short and long-term goals. The short term was reduce self-doubt and emotional reactivity to the microaggressions. The long-term goal was developing a confident leadership identity independent of external validation. One of the most significant mindset shift came when she realized she had been working twice as hard not to grow in the career, but to convince others that she deserved to be there. What I did, I emphasized her that the work should be for herself and not for the approval of the others. On the first step was about creating emotional safety. Her military environment had conditioned her to maintain emotional distance, making it difficult for her to express vulnerability. She had developed a behavior of always anticipating scrutiny from the colleagues. And to help her regain a sense of control, we implemented practical grounding techniques. For instance, tactical breathing used in training situation, or to regain focus and composure. There are various breathing techniques. I'm not gonna go here now. And visualization exercises where she mentally placed herself in different scenarios before where she was respected and in command. And this created an internal space of security, allowing her to handle external pressure more effectively. On the fifth step, understanding compassion in feminist leadership. So as she developed confidence, we explored third wave feminism, which challenges the notion that leadership must conform to traditional masculine models of authority. It must not. So I encourage her to see that her approach to leadership, collaborative, thoughtful, and strategic, was not a weakness, but a strength. She did not need to imitate the male colleagues, and she needed to develop her own style. So this realization liberated her from the pressure of constantly trying to fit in. The sixth step is training assertive responses to microaggressions. We worked on subtle but effective responses to workplace bias, and I'll give you a couple of examples. For instance,
I'm sorry to interrupt real quick. I just wanted to let you know that we're about 4 minutes into questions, which, since we got started a little late, is okay. But if you could maybe, if you haven't already, start thinking about wrapping up, and we'll get into questions.
Okay, it's only 4 steps
Okay,
left, and
great.
I'm done.
Just wanted to let you know. Thank you.
Okay, so training assertive responses. When a colleague commented, "You're actually really competent for someone who didn't go through the standard route," she responded, "Competence isn't about the route, it's about the result, and the result speaks for themselves." Okay, the seventh step, mindfulness as a tactical skill. We integrated mindfulness techniques into her military routine. For instance, pre-meeting grounding, a few deep breath before high pressure discussion, or post-interaction debrief, writing down reactions and alternative responses for future reference. And after that, she reported less overthinking before meetings and increased mental clarity under pressure. The eighth step is about restructuring emotional narratives. She transformed her inner dialogue from "I need to prove I belong" in "I belong because I'm already here." The ninth step is strengthening workplace relationships. And instead of distancing herself from colleagues, she cultivated allies, those who respected her and her work. And the final step is final evaluation and future application. So the results were reducing emotional distress from workplace bias, increased assertiveness without hostility, and stronger leadership identity based on competence, not on external approval. So basically, this is it. Tried
Thank you
to
so much. That
finish.
was great. Questions until 12:30?
Hi. That was
Hi.
a wonderful presentation.
Oh, thank you.
And could you just repeat? Maybe I zoned out for a moment. What was the tactic for responding to the microaggressions?
Assertiveness,
Okay.
assertive answers.
Great. Thanks.
Welcome.
Yeah, I really like the combination of the logic-based and then the compassion.
Thank you.
So you can work both at the same time, so that I think also with the compassion, there is maybe more openness to the seeing the inconsistencies and the irrationalities and so forth, because you feel supported.
Yes.
So I think that's a very nice sort of working both sides of, the coin, so to speak, so that you can be a whole human being, not just a brain with,
Yes,
a logic.
thank you.
Yeah, thank you.
Thank you.
And it was, I think, a very good case study. It made, you took it through the steps and made it very clear, I thought.
Thank you.
The question in the chat has to do with Martha's question, so I just want to interject. Can you share some examples of microaggressions in the military?
Well, they were disguised as jokes or fake compliments. For instance, you're so beautiful for a woman in leadership position, or I don't know. Can you make a? Just let me remember. You made incredible progress for someone of your ethnicity, something like that. Fake,
Right.
fake compliments, fake.
Well,
Very good.
sugar-coated bullets.
Those are very
Maybe.
helpful examples. That question was coming from Angelica, if I didn't mention that.
Oh, okay. Yeah, I see. I
Anyone
remember
else?
also, sorry. No, sorry. Continue.
Any other questions?
I would like just to mention an interesting linguistic clue, since we are talking in the philosophical aspect of these stories. When we talk about logic base and connect it with the compassion, in Romanian, the word for mind, for the brain, is minte, which is the same word as to lie. So it's just when we are talking about the rationality or the irrationality of a thought, basically we always have to examine what kind of language model the client is using, and if it's a large language model or it's a slower lower language model, a small language model, because as I said, the organ which is about the thinking part and the reasoning in the Romanian language is called the liar, minte. It's means it's the same word as lie. So it's just an interesting observation.
I think it's what it's called false friends. It's only a coincidence of similarity between the two concepts. I don't think it's the same. I'm not a linguistic though, but my my sense tells me it's just a coincidence.
I think it's a wonderful presentation, that you gave, and you do a good job, I think, systematizing, the connections between aspects of logic-based therapy and utilizing compassion. And one thing, though, that seems to be an assumption that people here are making, not you, but and that's that somehow reason, and emotion are antagonistic to each other, and that on a practical, level, they're still different. They're still kind of like, water and oil, but that's not true. The way the brain works, for instance, is in the practical domain, reason and emotion go together. And when you make practical decisions, that emotional reasoning that you're doing, and behavioral reasoning, is combined. I mean, you can't separate them. And so a popular criticism of LBT has been that LBT is just cerebral because it has logic. But that misses the point that you can't deal with emotions without dealing with reasoning. And that's, I think, a point that needs, I think, to be emphasized. What I see is very, very useful, in your approach is you're kind of fine tuning and clarifying how these, the compassion and some of the techniques of logic-based therapy with the analysis of fallacies and getting rid of them and so forth, can be utilized in conjunction, with
Yes.
compassion and the like. And that's basic. That is what logic-based therapy does. It sets us free from the irrational thinking so that we can, be compassionate. I mean, because if we're caught, in self-damning and telling ourselves we're worthless screw-ups, you're not going to be compassionate. And so to help an individual to get rid of, just relinquish those irrational, modes of thinking enables you to turn, to the compassionate side, which involves, maybe some, as a technique, what I use sometimes is compassion meditation, where clients are given guided meditations, to go and think of and send loving kindness to themselves and to say to themselves that they are, worthy, not their relatively, wasteful, inferior. And I think this fits in well with, working on, from a feminist perspective to help individuals to start seeing themselves as not, these inferior beings that are precipitated by these microaggressions that they have to endure. So, well done. And it's you're talking about mind reading. It's funny because later on in my presentation, I'm going to be talking about a bit about Carol Gilligan in connection with logic-based therapy.
Know that.
So we'll see how that works.
Yeah, I'm very curious.
Thank you very much. Very good.
Thank you. Thank you.
Congratulations, Anna. I very much appreciated your presentation.
Thank you.
It was a
I
pleasure.
was so nervous because of the technical problems in the beginning, but after that.
No, don't worry about it. The thing I most appreciate was the fact that you have this systemic view that you brought into presentation, where you decide to take emotions seriously despite their maybe rational or irrational nature, but taking them seriously and deciding to look at them from a systemic perspective means you are ready to see what they mean in that systemic context and what they point to, not only in the individual, but in the relationship of that individual with that particular context. And I think this is really an important step for philosophizing, let's say, about emotions, because it's a real move from pathologizing the individual to trying to think what does a particular emotion show about the context and the relations between the individual and this context. So that's one of my favorite parts of it, yeah.
Thank you. Thank you for the feedback.
Anyone else? We have 2 or 3 minutes left.
I'm sure you all have a lot of resources on the rationality of emotions and that sort of thing, where, you know, combining that. But just when I've had my camera off, I was like, oh, I'm going to get some books to share. But this book is helpful, The Rationality of Emotions by
Oh, thank you. I like to.
And Healing Emotions by the Dalai Lama as well. Oh, this is interesting too. The science, the molecules of emotion.
I've used this one with Dalai Lama in the research. I think so. I recall now.
Yeah, this book was great. I loved it.
Oh yeah, it's really helpful.
Thank you. Thank you very much.
Really looking forward to reading your article about this. And if you want to share your presentation, which we have not been able to see, that would be really awesome.
I like to do that, of course, but when, I don't know, maybe on email.
Yeah.
I can send it to you.
You can try to add the attachment on the share screen too. You can try to add the attachment to everyone here. I don't know how to do that. It looks pretty easy.
Yeah, you just open the chat
So
and then you drag and drop into the chat the
that I
presentation.